Hi, everyone, and welcome back to another episode of Office Hours with Jess. So, today I'm going to do something a little different and actually talk specifically about my own research. And I thought I would put together a little summary presentation of what I did during my master's thesis that then sort of led to my doctoral dissertation and is now informing my future work in the grants that I'm writing right now to study adolescent co-use more in depth. So really excited to walk you all through sort of my passion for why I study what I study. So today I'll be talking about adolescent co-use of tobacco and cannabis and implications for school-based interventions. Quickly, I just want to say I have no conflicts of interest to disclose. And I will be going through, again, a quick background, both about me and what brought me to this research, as well as the research topic. I'll go through 3 studies that are all related to co-use of tobacco and cannabis. Then I'll talk about where this is all going and the future steps of my research. So I want to just ask, take a moment, do you know what a JUUL is? So this was a product that in 2018, when I did my summer internship for my master's in public health, took the tobacco e-cigarette market by storm. It was 70% of the e-cigarette market, but more concerningly, at that time, over 30% of adolescents were reporting any kind of past 30-day use of this e-cigarette product. And again, this is extremely alarming because one pod of nicotine, or one of the little e-liquid cartridges that goes into this JUUL device, is equivalent to the nicotine that's found in 2 packs of traditional combustible cigarettes. So adolescents, back in 2018, unknowingly, for the most part, were consuming high amounts of nicotine through these newly popular JUUL devices. And why was this the case? It was so popular on social media. So as you can see here, there are 2 pictures. One is actually a photo of an old JUUL advertisement that got so much criticism for appealing directly to adolescents. And then you have the other picture with Pooh Bear in the bottom. And this is probably like some online user generated meme, but actual adolescents probably, or people in the population, were creating these appealing images that were making fun of the product, but also in a way making it popular and sensationalized as well. So why do I care so much then about substance use in schools? Well, this was happening in a very alarming rate back in 2018 when I was doing my master's research. And at that time, I was sort of investigating, why JUUL became so popular so quickly, and also helping design some school-based educational materials because there was nothing out there on e-cigarette prevention because it was such a new topic. And it was a combination of this research as well as coming up with ways in the moment to also design school-based interventions that really sort of absorbed me into the world of adolescent health, adolescent substance use prevention, and why schools are such an important place to intervene. And again, this whole experience of doing public health research during the adolescent vaping epidemic in 2018, 2019 is what really pulled me into wanting to research the complexities of adolescent vaping and doing so in a school-based setting. So with that, I went on to continue my doctorate journey and studies. And while doing this, I learned more methods, I learned more theory, and also dived into more of conducting different projects on adolescent vaping and substance use. And in doing so, I always noticed that, for example, here, prevalence of past 30-day vaping of both nicotine and cannabis is quite high, as you can see from the 2023 Monitoring the Future data. 20% of 12th graders used nicotine e-cigarettes in the past 30 days, and then almost 20% did so for cannabis. But what's interesting here is not just for the Monitoring the Future, but most data, they report all these substances separately. And I found that interesting because there's obviously overlap between these bars here on this chart. And I started thinking, well, like, how many of these adolescents are doing both and other substances too? And so I really got interested in learning about, adolescent multiple substance use and not just vaping. This sort of summarizes what I just mentioned, but I noticed again, there were just like a lot of gaps in the literature in terms of not a lot of studies, both qualitative and quantitative, that combine tobacco and cannabis in the same study. There were a lot on, the dual or poly use of different tobacco products, but looking at tobacco and cannabis together, there was definitely less of those types of studies. And there's also a lack of research on school perspectives and what barriers and facilitators schools experience when it comes to the adolescent vaping epidemic, as well as just adolescent substance use in general. So I was really interested in exploring that more. So the overall objectives of sort of my research agenda are to, one, involve and empower students and school personnel in research, and doing so through qualitative methods. In addition to qualitative methods, also applying rigorous epidemiologic methods to understand multi-level factors that influence adolescent substance use. And then lastly, wanting to understand best practices, barriers, and facilitators for interventions in schools. So I will now walk through three of my key studies that I've done in my academic training that have really led me to where I am now when it comes to researching adolescent co-use of tobacco and cannabis. So this all again started when I was in my master's program. And for my master's thesis, I actually did a qualitative analysis to understand adolescent and young adults' perceived tobacco and cannabis messaging online and through social media platforms. This study involved 24 participants aged 17 to 21, so sort of the older adolescent to young adult age. These were semi-structured interviews from October 2017 to February 2018. I conducted a line-by-line coding of the interview transcripts, and then conducted a deductive thematic analysis. So I sort of saw what themes emerged from all the data, and then kind of grouped them into themes. So I will be going through some of those themes now. So the first one is how the online messaging, advertisements, social media posts, they all contain components that directly appealed to adolescents and young adults. For example, participants described that they really like the aesthetic of advertisements or images looking simple, colorful, and modern. They also reported that messages were emotional and empowering, and that the fact that the products were easy to use or convenient to access, and how that was highlighted in advertisements, was also appealing to participants. Participants also talked about seeing messages from celebrities and commenting on that. So as you can see, here is a quote from a participant. I could see myself like taking a picture with a marijuana product, like actors like Seth Rogen, and all those other people do them. Like, this is fun. So Seth Rogen actually was explicitly called out by some of the participants as someone that they saw using cannabis online and then making that seem more okay. But it wasn't just celebrities that were sort of changing the norms around cannabis use, but also friends' messages and depictions online. So here's another quote. I used to have very, very negative feelings towards marijuana, But like when I've heard my friends have tried it, it's made me think that maybe it's not as bad as I previously thought. And people who do use it aren't terrible. They're just like regular people. And this was someone who had never reported never using a product, tobacco or cannabis in their lifetime. So again, just seeing these friends um, talking about cannabis online was enough to make them start to think that it might be okay, more okay than they previously thought. So the findings from this study really made me think, okay, there one needs to be increased regulation of social media content by the platforms. But I know that's a lot easier said than done. But it is concerning that a lot of young people were doing the advertising for the tobacco and marijuana industry. I do want to talk quickly about limitations of this study. The participants all attended high school in California, and we all know that California is very unique in terms of the context and setting for substance use, especially with, back then, I think even cannabis was just kind of perceived a little bit more openly than maybe in some other states. But I do want to say, despite this limitation of it being geographic to California, it was the first study to qualitatively understand adolescent and young adult perceptions of both tobacco and cannabis messaging within the same qualitative study. Um, so again, this really was like some of the early studies and work that drove me to want to look at adolescent co-use of tobacco and cannabis more. So for my dissertation, I did decide to focus more on understanding the prevalence and correlates of adolescent use of tobacco and cannabis. And for this study of my dissertation, I looked specifically at dual vaping, or the vaping of cannabis and nicotine specifically. And this was geographic to 5 New England states. So the objectives of the study were to describe the prevalence and trends of adolescent dual vaping during a 17-month time period from April 2021 to August 2022, and also to understand what correlates were associated with dual vaping among adolescents. The study population included adolescents aged 13 to 17. Roughly 120 participants took the survey every month over the 17 months. And although the study was not longitudinal, participants were allowed to participate more than 1 month in the study. And also, these are the 5 states that the adolescents came from: Rhode Island, Connecticut, Massachusetts, New Hampshire, and Vermont. For objective 1, I conducted descriptive analyses of the dual vaping prevalence and other vaping prevalence. And for objective 2, I conducted a multinomial logistic regression model to identify predictors of dual vaping for the entire sample using a survey package in R. So what's unique about this study is, in partnership with the MTCP, which is a state level tobacco organization in Massachusetts, and also, an interdisciplinary study team, we developed a new measure to ask what substances specifically adolescents were vaping in their vaping devices. So we asked, have you ever vaped any of the following substances in the past 30 days, with the following answer options? And if they vaped both nicotine, which was the first option, and cannabis, so that included THC and or CBD, the 2 options after that, they were counted as having dual vaped in the past 30 days. So that allowed me to create a vaping outcome for our multinomial model with 4 possible outcomes. The fact that they did not vape either nicotine or cannabis in the past 30 days, they vaped only nicotine or only cannabis, so in the past 30 days, and then of course the 4th being that they vaped both in the past 30 days. Informed by social cognitive theory and ecological systems theory, I wanted to look at multiple levels of influence. So the model included covariates at all of these different levels: the individual, social, environmental, and household level. Now, a very quick summary of the results. I can add the link in the description to this paper and all the papers I talk about if you want to see the full results. So we had a total of 1,858 participants. The average age was about 15 years old. Roughly half were female, half were male, and 4.6% did identify as non-binary. And a majority were heterosexual, white, non-Hispanic, and attended public schools. Here is the prevalence of past 30-day vaping for just nicotine, just cannabis, and both. So 5.7% reported vaping just nicotine in the past 30 days, 5.4 for cannabis, and then for dual vaping, so both nicotine and cannabis, was 7.5%. And key point here, of the participants that reported past 30-day vaping of any substance, over 1/3, so over 40%, reported dual vaping. And looking at the correlates, I found that paid employment, household tobacco use, more social media sites used, and higher COVID-19 impact score were correlated with an increased odds of dual vaping. So overall, I did find that co-use is prevalent among adolescents, and it really is important to ask what specifically adolescents are putting in their vaping devices and what substances they vaped. Mental health of adolescents was also very important and came up as correlates in this study. So it's really important to advocate for more resources where some of these mental health correlates can be addressed, such as adding more funding to school counseling departments and after-school programs. The study did have some limitations. It was a convenient sample through an online survey platform called Protege, and we did have some data constraints and in regards to measurement of the substance use questions. Yet, despite these limitations, this study was still innovative as we did utilize that new measure to ask adolescents what substance they are using in their vaping device. And it should become standard for all surveys to ask more granularly what substances people are putting into their vaping devices, and not just psychoactive substances, but even with now the increasing popularity of non-psychoactive substances such as melatonin or vitamins in vaping devices, it's still important to be understanding who is using those substances in their vaping devices. Now, lastly, I want to focus on what this all means when it comes to the school-based perspective and setting. So this third study is about barriers and facilitators to address vaping in Massachusetts schools using mixed methods from a study of qualitative school-based stakeholders. So the objective of this study was to understand barriers and facilitators to utilizing programs and approaches to help schools address student vaping in Massachusetts. There are two sources of qualitative data in this study. The first one came from a convenient sample of school personnel from high schools in Massachusetts, a total of 162 participants in that survey. And the participants included principals, vice principals, teachers, counselors, and school nurses. And the survey included qualitative open-ended questions that were fielded to Massachusetts school personnel from November of 2020 to January of 2021. So this study took the open-ended responses from that survey. And then what we did is we invited a similar pool of school personnel from that convenient sample of 162 school personnel from the survey to then participate in in-depth one-on-one semi-structured interviews from May 2021 to December 2021. Now, I'm very proud of these two sources of data because I really spearheaded the recruitment for the survey, and it was during, the really, really deep times of the COVID-19 pandemic when no one was vaccinated and everything was still virtual. So it was a really interesting time. And I'm really proud that we were able to get all this data during that time. And I also helped with then recruiting for the one-on-one interviews that happened approximately 6 months later, and helped conduct some of those interviews as well. So for the analysis, I conducted a thematic analysis of, again, line by line coding of all of the survey responses, as well as the interview transcripts using in vivo. And this was informed by the framework of pre-seed, which is used in intervention design and implementation, and usually is involving community stakeholders and appropriate to conduct a needs when conducting a needs assessment, which is essentially what I was hoping to do by understanding those barriers and facilitators. So these are the 5 key constructs that I drew upon when coding my interviews. So behavior, environment, reinforcing factors, which included attitudes of the community, predisposing factors, which included characteristics that make people more or less likely to adopt the behavior, and then enabling factors, which are the sort of resources related to the behavior, or like adopting the behavior. Again, this is just a highlight of the results. I'll include a link to the published paper to see the full study, especially since it's qualitative, that all the rich quotes will be in that paper. So of the 162 survey participants, 123 provided responses to the open-ended questions for a total of 310 open-ended comments. And as you can see, we got a nice spread here of the different types of school personnel roles, as well as you can see on the map of Massachusetts there. The green shows the number of people who completed the survey, and then those that are slightly darker green also completed the open-ended comments. This is just a quick snapshot of the demographics of the students in the schools that the 9 interviewees represented. And I won't go line by line here, but I did just want to say we got a nice spread of different student populations as well as different types of schools. So some of the key challenges that emerged were staff capacity and time, funding, and lack of mental health and counseling supports. A assistant principal did discuss the need for more in-person counselors, and that really, like, that was just a resource that unfortunately relied on funding, which was very limited. And many people or a program manager described that many adolescents were turning to substance use during this time of COVID-19 and isolation as a coping mechanism. I did want to bring up that there was a need for resources to address multiple substance use, and one principal highlighted that they wanted more interventions to treat dual dependence, such as cessation, counseling, and support programs that are specifically designed for vaping both nicotine and THC. So again, that importance of interventions specifically for co-use. So some facilitators are good things that help with promoting interventions that prevent and reduce adolescent substance use. One that got brought up was peer-led initiatives as well as parental involvement. These are part of the reinforcing factors of the pre-seed model. So one dean said, I had one of our students, she was in grade 10 at that point, come to me and say she wants to have a club to talk about this. How can she provide more educational resources on campus? Which is great because it's better coming from them than me saying it. Participants also talked about a move towards alternative to suspension programs rather than disciplinary action. So, for example, instead of getting just like 4 or 5 day suspension, these kids can opt for maybe just a 1 day suspension and then to join a program. And the program would consist of meeting with various adults throughout the building and building connections with them. This is a huge movement right now, is having rather than using punitive and disciplinary action when students are caught vaping on campus, to use a more restorative method such as alternatives to suspension that are focused more on education and building relationships with school administrators and mentorship, et cetera. And that has way better outcomes than straight up punishment. So, overall, peer led initiatives, alternatives to suspension, and parental involvement um, all helped with addressing student vaping. And we need more multi level strategies that are tailored to meet the needs of a diverse student body. And it's really important, I think, based on just how much information these school personnel provided, as well as how they reported a lack of resources, funding, et cetera, but still wanted to provide them. It's important to really invest in the role and training of school personnel as it relates to adolescent substance use prevention. So, some limitations for this study: the data were collected at different time points during the COVID-19 pandemic, but that's okay. I think it just gives us a much broader picture of like everything that was going on at that time. And this study was geographically unique to Massachusetts, but I think that we still learn a lot about from what Massachusetts did and apply that to other localities or states. This study was innovative. Again, this data was collected during the COVID-19 pandemic. I already described earlier about how much work I put into getting the data during this difficult time. So I think it is really special data that was collected and provides really particular insight into a particularly difficult time for students. And again, there's not enough studies out there on the perspectives of school personnel. So especially as it relates to adolescent substance use prevention. So I'm glad that this study could add to that. So I do just want to end on where this is all going. So kind of going back to my slide on my 3 kind of key pillars of where my research really grounds in, I'm hoping to take that to the next level. So continuing to directly involve adolescents and school personnel in research and interventions, and actually conducting true community-based participatory research from start to finish. I also want to use more granular longitudinal studies to understand co-use and learn how to use ecological momentary assessment or daily diaries, just to collect more granular information and get that more detailed behavioral and motivations for adolescent co-use of tobacco and cannabis. And lastly, instead of just getting the barriers and facilitators to what school personnel perceive, I want to help co-design and evaluate evidence-based multi-level interventions in schools that address co-use and multiple substance use, and really not learning, but like really helping with designing interventions and then implementing them and making sure that they are well received by schools and students. So that's what I have coming up next, working on many grants to go in that direction. So I'm really excited to continue my field of work. I just want to wrap up by acknowledging key funding source, my funding source for my doctoral journey, or my doctoral training, my dissertation advisory committee, my current mentor, as well as the statistical support I received, especially in learning how to do those multinomial models. And of course, I always want to say a special thanks to my main support system, my parents, who without them, I would not be here today and have this PhD and be conducting this wonderful resource. So I thank them for all their sacrifices and all of their support throughout my entire life that got me to where I am now. And this is again, me in a nutshell of my research, my passion, and what I hope to do next. I hope you enjoyed this little mini research talk, and I will see you on another episode of Office Hours with Jess. Don't forget to like and subscribe, and I'll see you next time. Thank you.